Hi everyone, thank you for joining today's webinar. We're going to be focusing on the necessary considerations when providing support services for justice-involved youth and their families. Our presenters will discuss resources for trauma-informed screening and assessment, treatment, disposition planning, and policy development that promotes system-wide adoption of trauma-informed practices. They'll highlight the resources created by the National Child Traumatic Stress Network, which is specifically designed for working with youth and caregivers who have experienced domestic violence. To begin today's presentation, I'd like to present Drs. Jane Holliday Goldman and Isaiah Pickens from the National Child Traumatic Stress Network. Take it away, Jane and Isaiah.
Thank you, Carlene, and thank you, Patricia. We are delighted to be here to talk to you today about our essential elements and about some of the resources that we've created as part of the NCTSN. I'm going to give you a little bit of introduction to the NCTSN and some of our resources. Sorry, skipped ahead. And then start in talking about a few of the elements, and then I'm going to turn it over to Dr. Pickens. So these are our objectives for today. We're going to describe the 8 essential elements for trauma-informed practices among justice-involved youth. We're going to talk about how you can use the essential elements to identify key service provision improvements for youth and families who are impacted by domestic violence. And we're going to be talking about specific resources that are related to each of the elements. I do want to point out that we have so many resources that are tremendous. Sometimes they can be a little hard to find, but we're always available to help you find them. So we're only going to get a chance to talk about a few, but if you have any other questions or there's anything specific that you're looking for, you'll have our contact information, so we're happy to help you with that. So for those of you not familiar with the National Child Traumatic Stress Network, our mission is to raise the standard of care and improve access to services for traumatized children, their families, and communities throughout the United States. Isaiah and I are actually from the Service Systems program within the National Center for Child Traumatic Stress. And our main goals are to work on projects that are related to helping systems and providers to understand and recognize the impact of trauma on youth and families and providers, and to create programs that effectively identify and address that impact and prevent re-traumatization. So the network itself was established by Congress in the year 2000 as part of the Children's Health Act with the mission that I just mentioned to raise the standard of care and increase access to services. We are funded through SAMHSA, and we are actually part of the National Center for Child Traumatic Stress, which is a collaborative between UCLA and Duke University. Dr. Pickens and I are both located at UCLA. But we have grantees all over the country, and they include hospitals, universities, community-based programs that are involved in training, intervention development, service delivery, product development, data collection and evaluation, public policy and awareness efforts, and quite a bit of treatment. So this is a map of our currently funded sites and our affiliate sites. So affiliates are people who at some point, since 2000 have been funded through the National Child Traumatic Stress Network. There are different kinds of organizations. There are some that develop interventions and do training, and then there are others that primarily do treatment, so they're indicated here on the map. Since it's really difficult to actually, figure out where the site nearest to you might be, and unless you're in one of the states that just has one, we're always happy to help connect you either with the site that would be closest to you geographically or to a site that specializes in any of the topics that you're most interested in. We definitely have sites that do specific work with domestic violence, others with juvenile justice, others with child sexual abuse. The list goes on and on. Skipped ahead a little bit. There we go. So I wanted to tell you a little bit about where the essential elements came from, and also why I know that your primary work is within domestic violence. We have a core data set of cases that have come to our sites from across the country. And we looked at just those cases that are just those youth who are involved in the juvenile justice system. And the trauma that was listed as the second most frequently out of all of those youth who were in justice involved was domestic violence. So out of 658 adolescents that are reported recent juvenile justice involvement, 51.4% of the males reported a history of domestic violence, and 56.3% of the females reported a history of domestic violence. So that's one of the many reasons we know that there's a pretty strong connection between juvenile justice and domestic violence. A couple of years ago, our Justice Consortium, and I'll step back and say a little bit about our Justice Consortium. We do most of the work within this network through our collaborative groups. One of our collaborative groups focuses on juvenile justice. It's made up of a fantastic number of people from around the country that include intervention developers and researchers, judges, frontline staff, administrators of both mental health and juvenile justice facilities. We have parents of youth who are in juvenile justice. We have some former youth who were in the juvenile justice system but are now young adults. So we have our aim of the Justice Consortium is to take the most recent research and move it to practice and develop tools that are really useful for people on the ground as quickly as you can. At the same time, we're collaborative, so we're a little slow, but I think that we do a pretty nice job, and we're going to introduce you to some of those resources. Many of them were created by this Justice Consortium. A few years ago, we held a roundtable that included NCTSN members who are involved in juvenile justice and some outside experts, particularly ones that were expert in family engagement, environment of care, treatment and assessment, looking at disparities and disproportionality, and working across systems. And we used that time to really talk about what are those essential elements of a trauma-informed service system. And then we've spent the last few years, looking at best practices, talking, really figuring out what people are doing that's working, looking at the research about what's working, and we've narrowed it down to these 8 essential elements that we think are really important for any program that's working with juvenile justice-involved youth to consider. So that's where they came from. In the interest of time, since we're going to go talk about each one of them, I'm not going to read through them right now. So the first one I'm going to talk about is the trauma-informed policies and procedures. Trauma-informed policies and procedures make juvenile justice organizations safer and more effective by ensuring the physical and psychological safety of all youth, family members, and staff, and promoting their recovery from the adverse effects of trauma. A few things that we think about when we help sites or systems look at whether their policies and procedures are trauma-informed are flexibility. One thing that we find is that it's really, everybody comes from a different background, a different set of traumatic circumstances, and we think it's really important to allow for an understanding of what that trauma was and how they might react to it, and then have some flexibility. For example, we had a learning collaborative where we were implementing a trauma grief component therapy for adolescents within a juvenile justice facility, and also staff training called Think Trauma, which Dr. Pickens will talk to you a little bit more about in a minute. And during that time, one of the youth were able to identify that the lights, that he was woken up every morning by these lights flashing on and off. And the staff had noticed that every morning he woke up in this terribly aggressive stance and, was really impervious to anything. You couldn't talk to him. He was just really aggressive, and it happened every morning, Monday through Friday. And throughout this process, he and his counselor were able to identify that that flashing lights was really a trigger for him for an ambulance experience that he had when he almost lost his life. And the staff were flexible enough to change their policy about waking him up every morning so that he could be woken up before the lights started flashing, and it dramatically changed his behavior. So flexibility is a really important thing, and that can, of course, be very difficult in a juvenile justice setting, but we think it's really important for that to be written in. We really believe in eliminating or at least reducing harsh practices such as seclusion, restraint, and shackling, and also finding practices to replace those with that also ensure the physical and safety of staff and other youth. The policies and procedures should include a trauma-informed safety plan, and that safety plan should be individualized for each youth, and it should include coping strategies that are effective for each of the youth that are within a juvenile justice organization or facility. It's really important, we think, to counteract the parent within trauma by doing things like ensuring that each youth have adequate legal representation by an attorney who understands the impact of trauma. We also are working on some resources for that right now. We think it's important to create safe spaces for youth and families so that they can regroup, whether it's within a court, a detention facility, or a mental health facility. There needs to be some places that when people are experiencing or agitated because of traumatic symptoms, that they can try to use some of their coping strategies and regroup. And then finally, policies, it's really important to have policies that support the implementation and sustainment of the practices that are related to the other essential elements that we're going to be talking about. Now, with each essential element, we talk a lot about different resources because this one is kind of a broad general one that just really says that these policies and procedures need to reflect the other essential elements. So we aren't going to talk about any specific resources related to that element. The second element is around the identification or screening of youth who have been traumatized. And we say that carefully timed traumatic stress screening is the standard of care for youth in the juvenile justice system. So this essentially says that we need to identify who has experienced trauma and who is suffering from traumatic symptoms. A universal, brief, valid, and reliable screening tool is often the best way to do this. It needs to be able to identify the symptoms that may have contributed to their offending and might interfere with their success in whatever programs they might be required to complete or volunteering to complete. It's really important that this screening takes place early, but at the same time, it's important to try to establish some degree of trust with the person who's doing the screening. That does not have to be a clinician. So this is an initial screening to identify youth that might need further in-depth assessment of their trauma symptoms and their trauma histories. So this is just an initial screening. There are a few other things are important. Actually, a lot of other things are important, but a few that I'll highlight are that youth and family really need to understand the purpose of the screening. They're likely to be distrustful or think that some of this information might be used against them. And if it's the case that it might be used against them, then they need to understand that. It's important to use non-technical terms and to also explain the results to the family. Even if the screening does not show any clinically positive results, it's really a great opportunity to still talk to the youth and family about any symptoms that they might experience and some kind of basic coping strategies that they might use. Because it's possible that a youth might not be comfortable enough to disclose any of those experiences or symptoms at this point in time. But if they're involved in juvenile justice, we know that the rates of trauma are well over 90%. So it's likely that there has been some trauma there. a few of the resources that we have, well, first of all, you do have the actual essential elements here under materials, so there are more points within that. But we have a few other things. We have a couple of webinar series. We have one specifically on screening and assessment in the juvenile justice system, and another for screening and assessment in the child welfare system. We also have a measures review database on our website. Our website is nctsn.org. One easy way to find all of our resources is to use Google. We're working on our website and are improving the search function right now. But what we're finding is if you, for example, Googled NCTSN Measures Review Database, it would be the fastest way to find it. And what that is a list of a lot of different measures that are used for screening as well as assessment. And it has reviews of them. It describes their use. It describes what populations they've been used with. And then you should also feel free to contact us if you're looking for any additional information or maybe an expert in any of these screening areas, or looking for someone who might help you kind of sift through those. The third essential element is the clinical assessment and intervention for trauma-impaired youth. So one important, so when that screening has been done, it will help you identify youth who need further assessment. That assessment needs to be done by somebody who is a clinician, generally a psychologist or a psychiatrist, and it's important that they have some experience working with trauma and working with justice-involved youth, because there really are some aspects of that that are specific that they really need to understand to ask the right questions to provide you or your system or your organization with the right information. So a few other points about assessment and treatment is it's very important that the assessment should determine the potential relationship of the post-traumatic stress and the behavioral health symptoms that are probably related to that to any criminogenic needs or risks and responsibility factors that are related to recidivism. It's often also, it's important for anyone making decisions about placement, about treatment, to really understand what this youth has experienced and how that might impact what they have done, even what they are likely to have done. And that will also help them identify the specific kinds of treatment that they're most likely to benefit from. The assessment, there are reliable and valid instruments available to help with assessments. And again, you can look at our measures review database for some of those. The assessment should identify past exposure and current exposure to traumatic events. And it should look at any current symptoms that they're experiencing and related behavioral health problems, such as psychiatric problems, substance misuse, behavioral issues, and also helped to make that connection about how some of those impairments might have impacted the psychosocial adjustment of the youth and their current legal status. This is, I think, particularly important with youth who have experienced domestic violence, to really have an in-depth understanding of how those experiences impacted the child, because it can come out in many different ways, and what kind of traumatic stress symptoms are they currently experiencing. Also, there might be specific reminders of, related to those experiences, since everybody's experience is so individual. Things happen in different ways. The result of the domestic violence varies quite a bit within different families. So it's important for the clinician to assess this and then to help the program understand what some of those reminders might be, so that if the child becomes particularly agitated or has behavioral issues or becomes extremely depressed, they might be able to help make that connection to the past domestic violence or other things that might have happened in the life of the child. And then it's also really important for that assessment to identify the strengths possessed by the youth and the families that can positively influence the legal process and also the treatment process. Through the understanding of the trauma and the behavioral health needs, a thorough understanding of the trauma and the health needs can also help you understand how this has impacted the child in a lot of different areas, such as relationships, school, health, etc. And that's really important for the clinician to understand through the assessment and those family dynamics. All of that information taken together is what's really going to help do the right case planning to identify the best interventions that are really going to help the youth. In terms of interventions, there are a number of interventions, such as some of you may have heard of Target or the trauma grief component therapy for adolescents that I mentioned. ARC, STARE, there's a large degree of well, actually there aren't that many, but there are a good number of solid interventions that have been tested for youth in the juvenile justice system. That's something else you can, well, I'll show you. We have a website, so you can also find more information about those specific interventions. But we need to think about a whole continuum. We're not just looking at these in-depth mental health interventions, but also at the different programming within a community mental health center or a juvenile justice detention center that can help a youth deal with the whole array of issues that might come up because of the trauma, including substance abuse or behavioral issues. So all of those different interventions taken together will help kind of create that program to help address the trauma and how that relates to the specific behaviors that the youth has exhibited. A few of the things that we have, I mentioned that we have this database of empirically supported treatments and promising practices. That's something else you could Google that exact phrase, and this will pop up. So we have basically fact sheets on many different interventions that specifically address trauma. And I have Target up here as an example because that's one that has been shown to be effective with youth in the juvenile justice system. So not only does this tell you a lot about the target population, the different components of the intervention, but there are also cultural specific fact sheets. So it'll tell you in what populations or with what groups has this been used with, and with any degree of success. So, or maybe, what languages has this been implemented with, et cetera. So it's a really nice kind of review of some of the interventions that are most useful in this population. We also have a couple of briefs which we've just updated within the last few years. One of them is on assessing exposure to psychological trauma and post-traumatic stress symptoms in the juvenile justice population. And then the next one is on intervention, so evidence-informed interventions for post-traumatic stress problems with youth involved in the juvenile justice system. So both of those kind of review some of the tools and interventions that are specific to addressing trauma with youth in the juvenile justice system. And they were written by some wonderful intervention developers, people like Julian Ford, Patricia Carrig, Erna Olafson, so people who have a lot of experience with working with youth and creating interventions to address that trauma. Isaiah, I'm going to turn it over to you to talk about the next essential element.
Thanks so much, Dr. Holliday, for that introduction and going over those first essential elements. I'm going to take the second half, and I want to start by having you all imagine a kid who is participating in a group activity. Say he's in a juvenile justice residential setting or maybe in different types of setting that's not necessarily residential, and a staff member comes up to him and asks him to sit down. And the resident doesn't respond. He kind of shoves him off, and then the staff member asks him to sit down once again, and he doesn't sit down. And it becomes increasingly escalated, and the resident says, don't touch me, but yet the staff member knows that this person, the resident, needs to sit down. And what eventually happens is a restraint. And this is something that's relatively common in juvenile justice settings. And part of what the reason is common is because many juvenile justice settings have a punitive approach to how they approach oppositional behavior from youth. And when we talk about a trauma-informed approach, part of what we're talking about is shifting your lens from why is this kid bad to what happened to this kid to lead to this behavior. And what that does is it changes the way you intervene when there is oppositional behavior, and it also changes the way that you reinforce behavior that you want to see. And so we are going to talk a little bit about how do you get staff to the point where their lens is changed and how they see the world different. And that's what this essential element number 4 is about, really being able to train staff in terms of understanding the education behind trauma-informed work, as well as being able to have resources around dealing with youth in a different way. And so as we talk about this process of training staff, I want to define a couple of terms just to make sure that we're all on the same page. I'll be talking a lot about traumatic stress reactions, and these are pretty much reactions that youth or adults can have in response to a traumatic event, and they generally fall under PTSD types of symptoms. When we talk about having hypervigilance or re-experiencing an event or disassociation, feeling like they're having an out-of-body experience, or some of the aggression that we might see, or negative moods or ways of thinking about the world. All these are considered traumatic stress reactions, and they're done because youth sometimes are reminded of the trauma that they've experienced. And if staff don't understand this, they might interpret youth who are trying to survive or trying to feel that they can keep themselves safe as bad behavior that they need to either discipline or treat punitively, and this generally makes the behavior worse. And it also can have an impact on the staff. What staff and the youth are usually striving for is what we call psychological safety. And psychological safety is really this idea that despite the circumstances that are happening around me, I have the inner resources to either manage those circumstances in a healthy way, or I can reach out to someone who can manage those circumstances in a healthy way. And what we really want to get staff to the point of understanding is how can we promote psychological safety in every part of the juvenile justice system. And so when we talk about trauma-informed programming and staff education, part of what we're talking about is helping staff understand these effects that trauma has on youth and on their families, and really understanding that when they interact with youth, depending on how they interact with them, the situation or the interaction can either escalate and become more volatile, or they can potentially help the youth feel safe and then also meet the needs of the facility of being safe as a whole as well. Just like the example that Dr. Holliday gave with the staff waking the youth up earlier in order for him to not have this traumatic stress reaction that he had when the lights came on and off. Another thing to keep in mind here as well is, particularly when we talk about residential types of facilities, we're really talking about a new family that the youth has to participate with. And as being a part of this new temporary family, some of the behaviors of the staff can really mimic in the eyes of the youth behavior of their parents or their caregivers. And when we talk about domestic violence, caregivers are some of the first models that kids have on how to connect with authority figures, how to connect with adults. And so as staff have a better understanding of how they interact with youth and whether youth have experienced domestic violence or other traumatic events within the context of the family, they'll be able to better navigate how to manage these reactions within a residential setting, or if it's not a residential setting, so that the youth can continue to feel safe without having to show these traumatic stress reactions. The other piece of this is we really want the staff to be able to understand how the traumatic stress reactions of the youth can impact them, both personally and professionally. And generally we talk about this in the context of secondary traumatic stress, which I'll talk about in greater detail in the next essential element. But just to give you a brief definition of secondary traumatic stress, is really when staff or whoever has indirect contact with a traumatic event, whether it's the traumatic stress reactions of a kid because they were reminded of a trauma, or hearing about traumatic events on an ongoing basis, when that individual starts to show PTSD or traumatic stress reactions themselves in response to this indirect exposure. And we'll also talk about vicarious trauma and some other aspects of that experience areas. But these are really important because they impact how the youth or how the staff interacts with the youth on an ongoing basis in the facility. And so part of what you want to think about when you're looking at trauma-informed programming and staff education is how you can support staff to have skills that really help them help the youth feel safe. And some of those skills may include helping them de-escalate situations verbally. There's many situations, like the example I gave earlier, where a restraint wasn't required if the staff verbally would have connected with the youth and said, look, I understand that you're feeling like we're just imposing this on you, but I'm going to explain why we're doing this, and creating a sense of predictability, because part of what trauma can do is it can undermine your sense of what's going to happen next, and now you feel like you need to survive and do whatever it takes to stay safe. But if the staff understands, oh, this is what's happening with the youth, let me tell him what's going to happen next so he can predict what will happen, and we can de-escalate the situation without having to have a physical interaction, that's a skill that would benefit staff greatly. Also, being able to monitor. This is a tremendous aspect, important aspect of staff training and education as well. We get frustrated on the job, and it's obvious sometimes to young people. And when we're able to manage this and really communicate it in healthy ways, we're able to model how they can express frustrating and angry feelings or other intense feelings that they may have in healthy ways. I was working in a secure detention facility, and the youth one time, they closed the door and made it difficult for us to do a support group that we were doing, a psychoeducational group around trauma, and they asked if I was mad and if I was angry. And I was able to tell them in a very calm way that I was angry and that there would be consequences for their behavior, but it was an opportunity for them to really see that you can have these intense feelings and you can express them in a way where other people don't get hurt, but they still understand what is happening with you. And so when staff are better able to understand that, this really puts them in a position to have better control over the environment, as well as be able to support youth to start the healing process from the trauma that they've experienced. Now, one of the best and comprehensive resources for this is a 4-module curriculum called Think Trauma. This is an 8-hour training for juvenile justice professionals, and this has been provided throughout the country. It was developed by the National Child Traumatic Stress Network, Dr. Monique Merrill and Joe Benamonte. They spearheaded this project, and it's really a comprehensive training that allows staff to understand how trauma impacts youth who are involved in juvenile justice system, how it impacts them not only in that moment, but developmentally, how it has impacted different domains of their life, socially, physically, in terms of their development, as well as cognitively and other important areas that really play a role in their decision-making process and other aspects. And then the other piece is that it really goes into how do you create safety plans, how do you create tools to be able to engage youth, and then how do you understand how this impacts you. So the secondary traumatic stress, the vicarious trauma, the compassion fatigue, and in fact, the newer version of Think Trauma will have a section called corrections fatigue, and this is specifically geared toward juvenile justice professionals in terms of understanding how does working in a corrections environment drain you emotionally and impact not only your professional life but your personal life. The other piece I want to say about this Think Trauma curriculum is that it's a train-the-trainer model, which is, I think, a great way to engage your staff. This is something that I did when I worked in secure detention, and what this did was allowed us to train the staff to be trainers of the trauma information that we're going to be given. And so I, as a psychologist, was a co-trainer with a detention center staff member. So this could be anyone from an administrator to someone who works directly with the kids who doesn't necessarily have clinical training. And so what that did was really allow some buy-in, because there was someone that the staff could relate to presenting this information and helping to change the paradigm of the facility from a punitive-based paradigm to a trauma-informed paradigm. But also it gave opportunities to support coaching and developing that process. And so from that perspective, this is a great resource. And it also provides an opportunity to have a concrete tool to shape policies with the administrators. Often with this training, what the trainer will do is sit down with the administrators of a facility and ask them to what degree can you implement some of these policies so that during our training we can actually refer to the policies that you're implementing to actually make this a more trauma-informed environment. And so those are a couple of great things. You can check out our website. There's a lot of great trainers around the country who, if you're interested in doing this training, will be more than willing to talk with you about how to get your organization connected with that. All right, let's move on. I'm not going to take as long on all the rest of the essential elements, but looking at number 5, prevention and management of secondary traumatic stress, STS, I just defined that earlier, and really what this essential element focuses on is the environment of working in juvenile justice and for that matter in child welfare settings can be tremendously draining in many ways. In fact, it's been found that upwards of 50% of child welfare workers experience secondary traumatic stress, and so this means they experience PTSD like symptoms or on that spectrum of symptoms by dealing with youth who've experienced trauma on a regular basis. We know that over 90% of youth in the juvenile justice system have reported being exposed to at least one traumatic event, and not necessarily showing PTSD symptoms, but many of them showing some form of traumatic stress reactions. So when we look at how we think about secondary traumatic stress in the work environment, part of it begins with being able to identify when coworkers or supervisors are experiencing STS. This can be another very difficult aspect of a juvenile justice setting. Part of what happens in a juvenile justice setting is you are taught to really be firm with kids and to really have clear boundaries, and part of that is not allowing youth to wear you down and not showing weakness, quote-unquote weakness in that sense. And sometimes when people are reporting that they're experiencing problems due to how they're interacting with youth, is seen as a staff member who is incompetent or a staff member who can't complete their duty with the necessary skills and requirements, and in many ways implicitly is told that you aren't good enough for this job, and that alone can be very draining. And so being able to create a culture where when someone recognizes secondary traumatic stress in themselves and that it's a normative reaction really when you're dealing with this many youth who've experienced trauma, and being able to effectively create coping strategies and address that, that becomes something that's tremendously important. One of the things that we found when we were working in juvenile justice settings is that the best worker often was punished. It was as if no good deed goes unpunished. He knows how to work, or she knows how to work with the kids really well. Let's give them the hardest kids and have them with those kids all the time. Now, that's not an environment that is using preventative and management strategies of secondary traumatic stress, because you're burning out many of your staff members and you're exposing them to potential secondary traumatic stress and vicarious trauma. This idea of these cognitive delays or depressed mood as it relates to constantly being exposed to this environment, as well as this corrections fatigue or compassion fatigue that we talk about as well. And so when we talk about developing and sustaining programs that can be used systemically, part of what it involves is training right from the outset. So as with the essential element 4, the same with essential element 5, it's important as soon as staff come into orientation, having them, giving them the opportunity to receive training around trauma-informed programming for how that impacts youth, but also how it can impact them. We have many staff who said that because of the work that they did during the day, they felt like they had less energy or patience with their children when they went home. And for many of them, they didn't realize why this was the case. They love working with people. They love giving. But when they were educated about how secondary traumatic stress can impact you professionally and personally, it started to make sense. And then they were able to put in place self-care practices to help them better deal with this. And so you see some resources here that are provided by the National Child Traumatic Stress Network, a couple of fact sheets around secondary traumatic stress that individuals can look at. You know, I would encourage you to put this in your facility so that staff can pick it up and they aren't necessarily penalized for asking for a break or for being able to create situations where they can care for themselves and have the energy to continue to work with the kids. The other piece you see here is the secondary traumatic stress speaker series, where there were a series of talks specifically around secondary traumatic stress. And this is something that's important in terms of continuing education. One of the things that we really stress in terms of sustainability of a trauma-informed system is that you don't just do this up front. Of course, you want to do the initial training so that people have the baseline of information, but in terms of being able to have this embedded in your environment, infused in the culture, you really want to do continuing education around many of these topics, and secondary traumatic stress is at the top of the list in terms of really helping staff and administration, reminding administration that it's important to look out for the well-being of your staff and your workers. So that's a series that you might want to incorporate into monthly staff meetings or potentially involve your continuing education program to integrate this speaking series as well. All right. So let's move on to trauma-informed partnering with youth and families. As we talked about earlier, trauma can really create a sense of disenfranchisement, powerlessness, and part of the way that you counter that is by engaging youth in their daily practices in terms of whether it's school and being able to connect with staff or people that they care about, but also in their legal process and being able to have as much of an understanding about what are the next steps, what will happen. And this, again, is many different pieces to this puzzle. There's staff who work with the youth in the facility that they're in, but there's also attorneys, there's judges, there's many people who work with the staff at different phases of their process. And when the individuals within these multiple systems better understand how trauma has impacted the youth and potentially led them to feel this helplessness, being able to empower them becomes a tremendous resource. Now, in terms of specifically some of the considerations for looking at partnering with youth and families, we said that 90% of youth, it's reported 90% of youth have been exposed to some traumatic experiences. Trauma does not happen in a bubble. It happens in a context, and many times the context is within a community and specifically a family. And so when we talk about trauma for the individual, we're often usually talking about intergenerational trauma. And so intergenerational trauma refers to the traumatic experiences that an individual has had in terms of their parents have had, and it has been transferred in some way to their child. And we see this a lot, particularly when it comes to interpersonal types of traumas, whether it's domestic violence or sexual abuse. Many parents, who've been sexually abused as a child, they find that they're very hypervigilant to what happens, particularly to their young daughters or individuals in their family, and yet there might be because of their the trauma and its impact on their ability of making decisions and how they protect their kids may still be at risk for some of the same things that they have experienced. And so that transferal of traumatic experiences, or just the reaction to the kids' reactions to the parents' traumatic stress reactions, can play a role in how the youth are willing to engage in the process. But making good faith efforts to include family and service planning, especially people that the individual identifies as family. And we'll talk about this a little bit when we get to the culture and health disparities component. But many times the youth who are involved in juvenile justice systems, who they consider family may not be the traditional family that we always consider. There might be an uncle or a cousin who they feel much closer to and would help them get through this process better than a biological parent. And figuring out ways to include family that the youth finds important to them, healing and moving on to the next part of their legal process and being a productive citizen is important to engage as well. And being able to obtain tangible resources and assistance that reduce obstacles to engagement is tremendous. Many times, especially when we come from a mental health perspective, we say, all right, we need to give them this evidence-based treatment, and we need to have them assessed for X, Y, and Z, and all these great things, these very great resources, but we haven't thought through how are they actually going to transport from their house to the place that they need to get the treatment on a weekly basis if they can't afford to get a cab, or if there's no metro available near them, or if we're saying we want to have the treatment at a certain time of day and their neighborhood is dangerous and they don't want to go out during that time of day, or they have work at a different time. So all these different considerations are tremendously important when we talk about engaging family and really seeing what they're going through and their obstacles from their perspective. Having that level of empathy for them is something that is truly, truly important. So when we talk about these different types of resources, I'm going to allow Dr. Holliday to talk a little bit more about these resources.
Sure. Well, this is one we wanted to make sure you all saw because of your work in domestic violence. This is a set of 10 fact sheets that we created with Futures Without Violence, and they're really aimed at parents. So these have been used, they've been kind of copied and put in pediatricians' office, child welfare agencies, community mental health centers, family violence centers, shelters, et cetera. And they go through, the topics are listed here, but they're specifically for parents who are involved in domestic violence situations. So how does DV affect children? Celebrating your children's strengths. Before you talk to your children, how feelings matter. It's really about a kind of assessing your own feelings, listening and talking to your children about DV, et cetera. It goes down to helping your child to navigate a relationship with the abusive parent. And then there's a lot about a parent's self-care and self-reflection. So they're really nice. I encourage you to look at them. Again, probably the easiest way is to Google NCTSN Children and DV Fact Sheets, or we have a lot of different domestic violence resources. If you go on our website, nctsn.org, to trauma types and then domestic violence, this is listed under resources, but there's some other nice information there. So this is one way when partnering with youth and families, or to actually give them resources so that they can use, that parents can use with their children. We also have a couple other ones. One of my favorite, which is probably going to be updated in the next few years, but I find it still extremely relevant, is this Pathways to Partnerships with Youth and Families. And what I like is that there's really two levels of partnerships here. So one of them it includes an organizational assessment, so you can look at your organization and see different ways, kind of look at different ways that you might incorporate a family perspective, in an advisory board, in making programmatic decisions, in a whole bunch of different ways. And then it actually goes through concrete steps for if this is something you're not doing, for how to implement those kinds of practices. And then there's a second side of that, which is individually or clinically, or, when you're working with a family, how to engage them into the treatment of the youth or child. And it has a whole clinical assessment for, that a practitioner can go through to look at their practice and how they're doing. And then a newer resource is this Sharing Power, a tool for reflection, which I think is also a nice thing to go through and look at administratively or within your individual practice when you're looking at ways that you can more meaningfully and consciously include youth and families, or partner with youth and families.
Thanks so much, Dr. Holliday. We are going to move on to the seventh essential element, which really is looking at cross-system collaboration. And what this involves is many of our youth are involved in multiple systems. And in fact, when youth are involved in both the child welfare system and the juvenile justice system, we often call them crossover youth. And you may have heard that term before. And so that has many implications for developing a trauma-informed system. One of the major implications of this is that youth may need several overlapping services, and being able to understand their needs is something that is very important but can also be very draining if youth are completing several of the same types of trauma-informed assessments or screening processes, when in actuality, if we were able to communicate that information, it would make it much easier. And so this is when it's really important to think about memorandums of understanding or memorandums of agreement with agencies that you may have an ongoing relationship with as it relates to youth, so that you can have this a more open communication around youth who have experienced different traumatic-based experiences and are showing traumatic stress reactions. It also really helps with the transition process. Often the receiving agency may not be aware of what triggers a youth or what makes a youth feel safe. And when they have this information up front, it really accelerates the process of the youth being connected to the staff there and feeling that they can get the necessary support and resources around their needs in this new setting. And then the other piece, of course, you have to be mindful of confidentiality, particularly in juvenile justice settings, as some forms of information may be used in their legal proceedings. And so being aware of that is very important, but that also makes it that much more important to be in contact with, as much as possible, with their legal representation, as well as with the agencies who are facilitating their care. As youth go into the courtroom or other settings, there may be certain aspects of that that are triggering for them. And so when the staff are aware of these processes, it really facilitates a more supportive environment. And then one piece that is related to this and related to our previous element of prevention and management of STS is really supporting supervisory practices that help both the intra-communication, so within the system's communication, so that it facilitates better communication between inter-agencies. Supervisors who understand trauma-informed practices or understand the process of debriefing after an incident, so that there's clear communication about what happened and people know how to report what happened. This really helps in the process of safety planning and communicating between systems. And I'm going to hand it over to Dr. Holliday one more time to talk about some of these resources.
Okay, this is definitely an area where the tip of the iceberg is very relevant, because I think a lot of our resources try to have some cross-system components to them, in part because I think it's really important to have tools for different systems to communicate with each other. So the few of the things that I'll mention, one is actually an article that was recently published that Carlene Gonzalez and I worked together with Erna Olafson on trauma-informed collaborations among juvenile justice and other child-serving systems. And so this describes some of the promising practices that are out there, practices like trauma systems therapy or child development community policing, which is a model out of Yale for specifically, originally it was developed specifically for domestic violence cases, where a clinician or social worker works together with police and to help in all stages of a domestic violence situation. And also we talk about the Georgetown Crossover Youth Model and the Tuskegee School Justice Partnership Model. And there are some other practices as well. The bench cards, the NCTSN bench cards, were created for courtrooms. One of them, the first one, is for the judge. It kind of creates or outlines questions that a judge can ask to get for more information about a youth's trauma exposure and history, some safety issues from the child, current triggers in their current placements that might be playing a role, and the unusual courtroom behaviors they might observe, and helps them kind of consider some of these traumatic experiences in making decisions. But the second is a really great cross-system tool because it is a bench card for the court-ordered trauma-informed mental health evaluation of a child. And a lot of times a judge might order an assessment, but they're not quite sure what they need, what information they need. And a lot of times clinicians are hesitant to give a lot of information about a child's trauma history because they're afraid it might be used against them. So what's really nice about this is it's something that a judge can just copy and hand to the clinician when they order an assessment. And it gives an outline of the specific information that they will need to make their decision. And we also find clinicians tend to find it much more comfortable to provide this kind of information because it's very clear how that's going to help the judge make the kinds of decisions that he or she might need to make. And then another resource is Cops, Kids, and Domestic Violence. This we created with Yale. That's the same site that developed the community policing child development model. And this is used most often in roll call trainings with law enforcement. So there's a video, and it's we actually had a police officer and a police chief that are giving the training because we find that that's most effective when trying to train a police officer. And it's they're really playing on the idea or the importance of the officer's role in providing both physical and psychological safety and how key that is for families experiencing domestic violence. So in addition to a training, there's also a lot of kind of tip cards and a lot of resources for police officers. So those are all also available on our website.
Thank you so much, Dr. Holliday. For our final essential element, we will discuss how trauma-informed approaches impact addressing disparities and diversity. And even though we only have a couple of minutes left, this is no reflection. You shouldn't leave this as an afterthought. This really should be a part of and integrated into your process of understanding how does trauma impact youth of different cultures and creating resources that really address that need. When we talk about trauma, again, it happens in the context of a community. And one of the aspects of trauma that we sometimes reference, but we don't talk too much about, is historical trauma. And this really speaks to the idea of systemic ways of biasing people, whether it's racism, sexism, homophobia, in any type of way that youth or adults as a whole are stigmatized or excluded. This really does play a role in how the youth and their families see the system that is supposed to support and help their child, and whether they can trust that system, whether they can trust people in that system, and also whether the system is presenting information in a way that they can understand it. So being aware of these cultural differences or cognitive limitations or language barriers that play a role in different cultures is tremendously important in terms of how you assess whether trauma has happened and how you screen whether trauma has happened, in addition to how you provide resources, treatment, and other legal support to the youth. And so when we talk about this, we have a series of different spotlights on cultural aspects of the youth's experience in general. This isn't necessarily geared specifically towards the juvenile justice population, but it's a lot of great resources on how to support youth who are immigrants or their family has recently immigrated, or LGBTQ youth, and how to help them feel safe in this environment. Again, part of what we're striving for is to create this sense of psychological safety in young people and in communities that may not have felt that before because of historical trauma or other traumatic experiences that have happened in their life. You can find that on our website as well. As we wrap up, just some take-home messages that we really want to highlight is it's really important to have a trauma-informed environment that understands not just why a kid is who they are, but what happened to the kid to bring them to this place. And it's really about understanding them in their entirety and understanding that the experience that they have, whether it's a traumatic-based experience such as domestic violence or other experiences that have led them to believe that they need to behave in this way to achieve whatever needs that they have or to work outside the legal system, that we understand there is the possibility for them to recover and to really learn how to be healthier from these experiences, but we have to create that environment to bring them to that place. And so we thank you guys for your time. This is Jane and my information. If you all have any follow-up questions about this, I know this was a lot to digest in a little bit of time, but we thank you for each of your time.
Thank you, Jane and Isaiah. That was a great deal of information. We really thank you for putting together all those resources in a concise manner. I'm going to hand it over to Alicia and Patricia to hold up the link and to tell all of the audience members where a recorded version of this webinar and all the PDFs and publications that Jane and Isaiah spoke about earlier will be available on our website. So Patricia, I'm going to hand it over to you.
Hi everyone, and thank you for joining the webinar today. Once we close out in just a minute here, you'll all be prompted to complete a survey where you can also request a certificate of attendance. If you're not automatically directed to that survey, you can come back into this room and pull the link from the web links box and still request the certificate. Once the webinar recording is processed, it will be posted to our website, and we will be sending out a notification when that's available for viewing to everyone who registered. Thank you so much, and have a wonderful day.